Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. The meeting is being interpreted in American Sign Language by Kim Rich, and Carlos Saracede is interpreting the meeting in Spanish. His interpretation will be available on the county's webpage and YouTube page shortly after we conclude this press conference. Once again, with warm weather expected at local beaches this weekend, there could be many people who want to get out to the sand. Fortunately, Los Angeles County reopened its beaches this week on Wednesday. All beaches from Santa Barbara south to San Diego are open to the public, so the pressure on our own local beaches from out-of-town visitors should be significantly reduced this weekend. The Sheriff's Department will be again patrolling beaches and trailheads to protect public safety by encouraging compliance with physical distancing requirements. Lifeguards and park staff from all the other local jurisdictions across the South Coast will again be out reminding people to be safe outdoors. Next Tuesday, the County Board of Supervisors will consider an urgency ordinance that would create additional authority to limit parking during the declared COVID-19 public health emergency. This new parking enforcement tool will allow the county to work collaboratively with other local cities to control overcrowding at neighborhoods near local beaches. Regional coordination will help us all be better prepared as crowds increase during warmer weather this summer. Sheriff Bill Brown announced at the Board of Supervisors meeting on Tuesday that the Sheriff's Department and all local law enforcement agencies throughout the county have adopted a coordinated enforcement strategy to address violations of the governor's stay-at-home order and the local public health officer orders. The sheriff said law enforcement will continue to engage, educate, and encourage people that they see or are reported to be violating the public health orders. Sheriff Brown said this strategy has been very successful. Local residents are very cooperative, and only in very limited circumstances involving repeat offenders has additional enforcement been required. The County of Santa Barbara has now completed our stakeholder-guided reopening and recovery plan. The RISE guide for reopening in a safe environment will supplement the governor's state reopening guidance. The document is posted on the county's readysbc.org website now. The Board of Supervisors will vote to approve this document at the next Tuesday board meeting. This guidance is designed to be a living document that we expect to revise as circumstances require. Congressman Salud Carbajal is in Washington today, voting to support the federal economic stimulus legislation called the HEROES Act. The House of Representatives drafted this latest fiscal stimulus legislation to address some of the inequities of the first rounds of federal legislation regarding COVID-19. Especially notable for our county is a direct funding allocation to the County of Santa Barbara and to each of the 8 incorporated cities in the county. This new funding will help local governments around the country pay for the increasing cost of responding to the COVID-19 pandemic and also help offset lost revenue from the economic shutdown. The United States Senate must also approve this legislation, and the President must sign it into law to go into effect. Today, I'd like to recognize the work of Hospice of Santa Barbara. During the COVID-19 pandemic, Hospice of Santa Barbara continues to provide their essential programs while also stepping up to assist our wider community. Hospice is used to serving individuals and families during the hardest of times. People with terminal conditions are facing increased challenges as members of their support system cannot join them in person to provide support and comfort. Hospice is doing everything possible to be the best support system for these patients and their families by creating new ways to help. In addition to this important work, Hospice has been deploying volunteers to help with local food distribution efforts, providing mental wellness services as part of the county's community wellness team, and educating the community about how to cope with physical, emotional, and social impacts of COVID-19. Thank you to Hospice of Santa Barbara for their dedication to serving our community. I'd now like to introduce Dr. Vonda Reynoso, the county's Public Health Department Director.
Thank you, Supervisor Hart. Good afternoon. The Public Health Department remains in full response mode to the COVID-19 pandemic. Our staff is working every day of the week to ensure the safety and health of our community while simultaneously preparing for the reopening directed by Governor Newsom and the California Department of Public Health Director, Dr. Sonia Angel. We are at a critical moment in which we as a community must maintain our diligence in observing physical distancing. We are excited to slowly see our local businesses open, yet it is imperative to remember that this trend will only be able to continue if new cases remain low and hospitalizations remain stable. Please know that your local health workforce is committed to navigating our community through this, but we need your help in making the next phase of reopening a reality. Stay home when you can. Please continue to wear face covering if you are interacting with others, and especially when physical distancing is not possible. And please postpone any visits with people that do not live in your home. These measures will help ensure we will continue on the path to rising out of this pandemic. Today, I'd like to share with you the case count. Today, we are reporting 15 new cases for an overall total of 1,402 cases in Santa Barbara County. And this describes the 898 cases from the prison and only 504 from the community. Of the 504 community cases, 27 people are hospitalized, with 11 in the ICU. 407 have fully recovered. That's 81% have fully recovered. Of the 898 cases in the federal prison, 797 cases are considered active, with approximately 99 cases fully recovered. Our local testing sites remain active, and we are pleased to report that testing results have come in. So for the past 2 weeks, we have conducted 1,768 tests with positivity rate of less than 1%. This indeed is good news. So of the 1,768 individuals who booked the appointments, 64 self-disclosed that they were asymptomatic. 25% self-disclosed that they were symptomatic. And of the 1,768 appointments that were scheduled, 54 disclosed that they did not have an underlying chronic medical condition, while 35% did. I continue to encourage community members to get screened and to make an appointment for testing. You can go online to lhi.care/COVID testing or call 1-888-634-1123. Additionally, if you need some assistance in making your testing appointment, please call the Santa Barbara County Call Center for help in English and in Spanish, and the number is 1-833-688-5551. This testing option is available to all community members, and we especially encourage community members around the Lompoc area to make an appointment as the schedule consistently has availability. And again, all are welcome for testing. As we move through this pandemic locally, many questions have come up about how we as a department are helping to look after our most vulnerable community members, including those who live and work at skilled nursing facilities and those who have been diagnosed with COVID-19 and their families. Our Deputy Director of Community Health, Paige Batson, is here to share more about our work to prepare and protect skilled nursing facilities, along with resources available to those directly affected by COVID-19. And also, so now I'd like to turn it over to Paige.
Thank you, Dr. Del Reynoso. The Public Health Department recognizes that elderly persons and those with chronic medical conditions are at higher risk of severe illness and death due to COVID-19. and therefore we have prioritized public health interventions to ensure a prompt response to any reports of suspected long-term care facilities and skilled nursing facilities. With the Public Health Department's established partnerships with community healthcare providers, we are able to quickly respond to and initiate investigations and testing. Of equal importance to protecting vulnerable residents in these congregate settings, it is equally important to protect the well-being of their workforce. With a single positive case in any skilled nursing facility or long-term care facility, the Public Health Department's investigation team launches a large-scale testing of both residents and staff and closely work with facility administration to ensure that public health interventions are rapidly implemented. Some of these interventions may include cohorting of patients, quarantine of staff, modification of visitor policies, and so forth. We are pleased with the infection control measures that our facilities have been able to implement to reduce the number of cases, outbreaks, and deaths in their facilities. To date, with 14 skilled nursing facilities in Santa Barbara County, only 2 have had an incident of positive cases, ranging between 2 to 5 cases among staff and residents, and 1 death. Moving forward, we expect that more regular testing of residents and staff will take place as a result of an all facilities letter that was issued by the California Department of Public Health on May 11th. This letter requires skilled nursing facilities to submit a facility-specific COVID-19 mitigation plan to the state. This mitigation plan includes 6 critical elements that must be met, of which one of them is related to testing. On a separate note, the Public Health Department is receiving a number of inquiries related to services provided while an individual is in isolation or quarantine. For community residents infected with COVID who are unable to self-isolate in their home, the Public Health Department's Isolation and Quarantine Unit is prepared to provide housing at no cost to the individual for the term of their infectious period. While an individual resides in our isolation and quarantine quarters, they are provided with food and linkages to necessary medical, social, and other community services that are available, while assuring that proper infection control measures are being adhered to. We recognize the negative impacts of isolation and quarantine to working clients, and we make every effort to identify available resources and benefits such as sick pay, disability and unemployment insurance, medical enrollment, and others. Our primary goal when providing isolation and quarantine is to ensure that our clients are safe and that families remain unified to the extent that is possible and desired. At no time will children be removed from homes of infected parents, as there are always sound measures to protect children and keep families together. In closing, we want to be clear that the Public Health Department is here to serve all community members, regardless of immigration status, language, or location. Thank you.
Thank you, Ms. Batson. Barney Malekian, the Assistant County CEO for Public Safety, is here to share an update on the county's work with the federal prison in Lompoc.
Thank you, Chair Hart. Since the beginning of this outbreak, one of the biggest challenging areas has been the federal prison in Lompoc. And the county, specifically through its public health department, has worked diligently to respond to the issue of disease outbreak at that facility. It is common knowledge that there are a large percentage of our county cases that come from that prison, and the county staff and the prison staff have worked very closely together. Recently, there was an event in which 2 individuals who had completed their sentence were released from prison as the law requires. The isolation and quarantine unit that was mentioned just a few minutes ago learned that they did not have a location place to go, and they still had 2 days left on their quarantine period. They were asymptomatic, but they were taken into isolation and quarantine and served with a health order. We later learned that one of the individuals left that quarantine facility and returned to the Los Angeles County area. Public Health has done outreach to Los Angeles County Public Health, and appropriate measures have been taken. Since that time, we have worked diligently with the prison officials on an ongoing basis to develop a protocol for responding more quickly to individuals who may be released from the facility while still testing positive. It is important to note that the individuals had completed their sentence. In effect, they were no longer inmates, they were free to go, and it would have been both illegal and inappropriate to try to retain them. The Public Health Department works very diligently with the prison officials and will continue to do so to address future releases so that we have more advance notice about them. That concludes that.
Thank you, Mr. Merlickian. We'll now go to questions from the room. Mr. Fish?
Yes, just wanted just a little bit more clarification, just to make sure we have the facts right there from that incident you spoke about. They were completed, the two men had completed their sentence, but left the quarantine facility 2 days before they were supposed to. Is that, could you just shed a little light on?
For clarification, there were 2 individuals who were released from prison and having completed their sentence, fully completed their sentence, and were placed into the quarantine facility. One of them left and one of them remained. Both of them had 2 days remaining, and both of them were asymptomatic. The second individual would have been discharged today anyway.
Thank you very much. And my second question is about the RISE plan. I know San Luis Obispo County put out their own localized plan, the START plan for a kind of localized look at reopening, but then this week kind of backed off of that plan and decided to say the state reopening is what they'll focus on now. So just wanted to see if you could sum up how the RISE plan is different from that, why it's important to have that supplemental plan along with the state's plan when San Luis Obispo ended up introducing it and then just kind of going back to the governor's guidelines.
Well, we, prior to the governor's guidance, when he described that there will primarily be a state-driven process for reopening businesses, we convened a stakeholder group to make sure that we were ready for the possibility that that would be different, that there would be a path locally to describe the circumstances and the conditions when business could open. That stakeholder group, including medical experts, industry leaders across the county, continued their work because we believed it would be valuable to have local guidance in addition to the state guidance, to supplement each other and to have local input into that process. So we think this document will be valuable. We intend to adapt it as circumstances change. It's really essentially a living document. So as guidance from the governor comes down, we will potentially reconvene that stakeholder group and work through those issues. But we're trying to be a partner with local businesses and help facilitate the process of reopening when that path becomes available to us.
I just had one more question regarding travel, weather you mentioned, and Memorial Day weekend coming up next weekend. San Luis Obispo County is putting in some restrictions on hotel capacity, campgrounds, things of that nature. What is the county and public health discussed when it comes to Memorial Day weekend, perhaps busier travel weekends, and maybe discussions you've had about limiting the temptation for tourists or visitors to come to the county?
Dr. Dovernoso, is there any addition from public health?
Yes, so I reviewed the San Luis Obispo guidance today, and in our county, hotel is still restricted to essential business only. That is per governor's guidance. With regards to opening up campgrounds, that is something that the county leadership team will be discussing. So with Memorial Day coming up right around the corner, I anticipate some clarification to be issued early next week.
Thank you for the questions. Are there any other questions in the room? Next, we'll go to questions on the phone.
Great. It's my turn.
Yes, we have time for a few questions. Raisa was sitting as Valley Star. Go ahead.
I kind of want to piggyback off of the Memorial Day weekend. I was up around the river this last weekend, and the forest had closed access. And we also went to Gaviota Beach where the parking lots were closed. And I just wanted to know, because people aren't really taking those guidelines seriously and then parking closely, not in designated parking areas along the freeway. Wouldn't it be better to just have the parking lots open so people are parking safely and block off, every other parking stall? And are you guys gonna have that come back?
The Forest Service parking lots and the state beach parking lots are decisions that the federal government and the state government have made to close those parking lots. Those are not in the control of the County of Santa Barbara.
Right, but could you ask them to open them up and limit, 6 feet distancing between stalls?
Well, each of the different agencies has chosen a different course, and we are in constant communication with our federal and state partners about the best way to manage those resources, but to date, they have not decided to change their initial decision to close those facilities.
Okay, and then my next question is regarding the skilled nursing and retirement homes that have zero access right now, and I fully understand why, but I've had phone calls from people that have loved ones up there that have had no contact with their loved one for over a month, and some of these people really are craving that contact with their families. I'm wondering if there's any protocols that are being put into place to maybe do a limited, social distance visit, or, even just through a window, just so they have actual eyes on their loved one. I don't know if there's anything put into place.
I'm not certain of any specific strategies that these facilities are using toward that end. I do believe that with this new mitigation plan, that this should, with the additional testing and screening, that this will open up opportunities to mitigate those visiting policies.
Thank you, Raisa. Next up, we have Laura Place with Santa Maria Times.
Thank you. Just one last clarifying question regarding the incident Mr. Malekian mentioned. Can you clarify which day the 2 former inmates were released?
They were released on Wednesday in the afternoon.
Wednesday, okay. Thank you. And then my next question is for Dr. Del Reynoso. With the 14 new cases that you mentioned, can you clarify how those are broken up between cases among inmates and cases among county residents?
Yes.
Or 15 new cases, I believe you said, not 14.
Right, there are 15 new cases. That would be 5 new cases from the prison and the remaining from the community.
Okay. And then one last question. Thanks for your time, everyone. For Dr. Batson, are you able to give an approximate number of the amount of county residents that are using this public health department provided quarantine housing?
I'm sorry, I do not have those numbers that use our facilities. I'm sorry about that. We could provide that in future conferences. I will tell you that the vast majority are able to self-isolate in their homes safely. And so, again, it's open and available as needed, but those numbers are just not available today.
As luck would have it, I was just on a conference call, so we're running an average of 5 a week.
5 individuals a week?
Yes.
Okay. Thank you so much.
Thank you, Ms. Place.
Those are all the questions.
Okay. I read an article this week written by an emergency room physician working in a New York City hospital about how the hospital medical team was able to protect its healthcare workers during the most extreme conditions of the peak of the COVID-19 outbreak. The secret? They meticulously followed the personal hygiene disciplines that I talk about at every press conference. Every member of the hospital staff made sure to personally evaluate their own health on a daily basis. Even the slightest inkling that they may be getting sick was enough for them to stay home and isolate themselves to stop the spread of the virus. They were also extremely careful to regularly and thoroughly wash their hands, often 10 times a day. They wore face coverings both in the hospital and while out in the community. The hospital significantly increased disinfection of all surfaces and equipment. The result was almost no transmission of the COVID-19 virus among hospital staff during the worst possible conditions. This example illustrates how important it is for each of us to maintain the same discipline in our daily lives. Please follow the 3 simple steps each of us must do every day to protect each other. Number 1, please stay home as much as possible. Remember to wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands very often and for at least 20 seconds. Don't touch your face and disinfect surfaces regularly. Number 3, if you feel sick, if you feel any of the COVID-19 symptoms at all, don't go out. Isolate yourself at home. After a couple simple symptom-free days, you can safely resume your daily activities. If your symptoms worsen, call your doctor or clinic and follow their medical advice. Our next press conference will be held Monday at 4:30 p.m. If you have any questions about anything we've talked about today, please call the county's call center line at 833-688-5551. Please be safe, get outside for some fresh air and exercise this weekend, find some joy. Thank you for joining us today.